Good afternoon. I'm Kathleen Ethier. My pronouns are she, her, and hers. I'm a proud lesbian, and I'm the even prouder wife of a middle school teacher. I'm very excited to be here. This is by far my favorite event every year. And while it's great to see my colleagues, the passionate professionals who are dedicated to helping LGBTQ youth, the real reason I love this conference is the young people who are here. I love watching you all work together to make this world a better place for everyone. You are the reason that we're all here. At CDC in the Division of Adolescent and School Health, one of the primary ways that we help LGBTQ youth is by providing data on the health challenges you face and what schools are doing to deal with those challenges. This data can help provide insight to public health professionals, educators, policymakers, and medical professionals seeking to drive change. Our Youth Risk Behavior Survey affirms what we all know, that despite some progress, we still have much work to do. LGBTQ youth are far more likely to feel sad and hopeless. They are more likely to attempt suicide. They experience more violence like bullying or forced sex than their heterosexual peers. And this is not acceptable. No young person should feel hopeless or experience injustice because of their sexual or gender identity. But I certainly do not want anyone to get the impression that LGBTQ youth have a hopeless existence or future. We are seeing significant improvements. Our school health profile survey, which is how we monitor what's happening in schools, shows that some really positive changes are taking place across the country. In the past 10 years, the percentage of schools with a gay-straight alliance has nearly doubled, and now 40% of middle schools and high schools have a GSA. More health teachers are learning how to make sure that sex education is inclusive for LGBTQ youth. And now more than 75% of schools say they identify safe spaces where LGBTQ youth can receive support from administrators, teachers, and other school staff. We've heard you ask for more data on transgender youth, and we all know that data has power and being counted matters. In our 2017 Youth Risk Behavior Survey, 19 locations across the country included a question that asked about whether students identify as transgender. And our 2019 data will be released later this year, and until then, I'm thrilled to be able to say that the number of sites asking this question has increased substantially. This increase demonstrates that state and local agencies are increasingly aware of the importance of providing the space for LGBTQ youth to self-identify and be recognized. We are seeing these positive changes for two reasons. The first is that we know what works. We know that inclusive health education, increasing access to health services, promoting safe and supportive school environments help LGBTQ youth lead healthier lives. But the second, more important factor is our commitment to work together to help and empower LGBTQ youth. You all in this room make the difference. You are advocating for and implementing inclusive sex education. You are connecting LGBTQ youth to health services that welcome them and affirm their identities. You are creating environments with safe spaces, supportive adults, and student-led inclusive clubs. And when I say you, I especially mean the confident, competent, and powerful youth here at this conference. When we were all together last year in Anaheim for last year's Time to Thrive, I walked through the lobby of the hotel, and I saw this literally big pile of young people. They were having fun, they were laughing, and they were just being themselves. And one of the wonderful things about this conference is everyone just gets to be themselves. And I will admit that I eavesdropped a little, and I can't. We don't have kids, so it's my opportunity to listen. I will admit that I cannot tell you how proud I was to hear someone ask a question about sexual health, only to have their peers provide them with correct and empowering information. So you can see why this conference is my favorite. I see our efforts in action. The youth attendees give me hope for all of our futures. So since we're all here, I have two things to ask of you. The first is to go back to your school or to your community and see how your school is doing. Look at your profiles data. See if your district or state collects youth risk behavior surveillance data, and utilize the tools that we provide on our website to implement strategies that will make schools more supportive and inclusive places. The second is for all of us to be the person in our building, in our community, that is visible and supportive and caring. We have the power, you have the power to make an impact and change a life. And that's why we're all here. It may not always feel like it day to day, but you are making a difference. We are making a difference. So thank you for your continued dedication to this work, and let's keep working together to ensure healthy, happy, and fulfilling lives for our LGBTQ youth. Thank you very much.